This is how clockwise rotation is performed during linear US examination. Rotate your left hand to the right shoulder, and for anti-clockwise rotation again rotate your left hand towards the left side only. Let's start with a pancreas examination from GE junction by locating celiac artery. In neutral position, you will see the left lobe of liver with a left vein running through it, and on clockwise rotation, you will see ligamentum teres, umbilical portion of left portal vein, and ligamentum venosum with a middle hepatic vein. On slight clockwise rotation, intrahepatic IVC along with the right hepatic vein will be visualized, and from that, if you do little clockwise rotation, you will see the aorta. And once you see aorta, you have to push your scope little bit. You will see the celiac artery and SMA coming from that, and on left extreme side you will see the pancreatic body. So you have to bring the pancreatic body in the center by pushing your scope. Once you see the pancreatic body, from here you can trace pancreas till tail by clockwise rotation and minimal withdrawal. So during rotation you will see the left renal vessels in addition to the splenic vessel, and you should never confuse these vessels with each other. So now here I am doing a clockwise rotation and left kidney started coming into the view, and from that if I do again further clockwise rotation, I will see the pancreatic tail. Spleen and left kidney are the hallmark of pancreatic tail. So always complete the examination till splenic hilum, and once you have examined tail, again do anti-clockwise rotation, but at this moment you have to push your scope minimally to see the genu of pancreas, because genu is placed lower up compared to the tail of the pancreas. So on anti-clockwise rotation I came till the confluence, and I have also seen a genu. So here you can see the confluence along with the SMV, splenic vein and inferior mesenteric vein. And to see SMA from SMV you have to do clockwise rotation. Once you see portal vein confluence, withdraw your scope and maintain a clockwise torque. By doing this maneuver, you will be directed towards the liver hilum. Here you see common hepatic artery, main portal vein and CBD are stacked in a sequenced manner, and from there if I do anti-clockwise rotation, I will be directed towards the left lobe of liver. Once you see the left lobe of liver, you can repeat this maneuver by clockwise rotation till the left portal vein becomes round. So at this moment, stop for the clockwise rotation and push your scope down and maintain a clockwise torque. So by doing so, you will be directed towards the liver hilum again. Pancreas examination from the duodenal bulb. In duodenum, transducer is facing posteriorly. Many structures are visualized from duodenal bulb. When you see main portal vein, that is a home base in a duodenal bulb, you will see the anechoic CVD in front of main portal vein and common hepatic artery and pancreatic head. So from here, if you do clockwise rotation, you will be directed towards the ampulla, and while doing so, you will see IVC, right renal vessel, aorta, as well as superior mesenteric artery running along with the superior mesenteric vein. So here you see the ampulla and pancreatic head. Once you see ampulla, do anti-clockwise rotation. If you do full anti-clockwise rotation, you will trace the whole CBD from ampulla to hilum. Pancreatic head and genu are very well visualized from the duodenal bulb. Once you see portal vein confluence, minimally rotate the scope in anti-clockwise direction without any withdrawal to see the pancreatic genu. Pancreas examination from the second part of a duodenum. The home base in a descending duodenum is aorta. In deep descending duodenum, transducer faces posteriorly. Once you see the aortic bifurcation, start withdrawing your scope slowly. Part of IVC and aorta are visible, and when you see IVC and aorta, gradually withdraw your scope by maintaining clockwise torque. So you will see the mesenteric vessels coming into the view. Along with the mesenteric vessels, pancreatic head and uncinate process also can be visualized. And to see the ampulla, release your big knob and instill some water. So with that, ampulla will get pushed away and you will not miss a small stone or lesion at the level of ampulla. Once you see the ampulla, do anti-clockwise torque to see the CBD. So here you can see an echoic CBD, pancreatic head and aorta. And to see the PD, you have to give a clockwise torque from the CBD. So both intrapancreatic part of CBD and proximal PD can be visualized from the duodenum part 2. From the ampulla, both PD and CBD can be traced until the pancreas body and liver hilum respectively. To trace the PD from ampulla, gently withdraw the echo endoscope while maintaining clockwise torque. During this maneuver, the scope may slip into the stomach and directly lie on the genu of the pancreas. So this allows tracing of the PD from the ampulla to the body of pancreas. At this moment, scope will be in a straight position, so you will be able to see the pancreatic head and uncinate process very clearly from the stomach. And from this point, if you withdraw your scope and do clockwise torque, you will be directed to the tail of the pancreas as said earlier.